before we make a start? If you can, could you start to introduce yourself in the chat? Tell us about your role, who you're with, where you work. That would be really helpful so we can start to see that in the chat. If you're happy to have cameras on, then that's fine. But if you could keep mics off during the webinar, unless you are asking a question, that would be really helpful. I'm going to give it, oh, I was just about to say I'm going to give it till 2 minutes past, but it's now 2 minutes past. So we're going to start. Welcome everyone to the Falls and Physical Activity Community Practice webinar. This is the third in the series of this series of webinars around making movement a priority in the community. Our first two in this series were around making movement a priority in hospital settings and in care settings. If you are able to introduce yourself into the chat, that would be really helpful. If you want to keep your cameras on, you're welcome to, or have them off. And if you can turn your mic off unless you are speaking, that would be really helpful. Just a big welcome from myself. I'm Melissa. I'm part of the Active Notts team. It's part of the community of practice. We've got two features of the webinar today. So we've got Caroline from Derbyshire County Council, who's going to be speaking with regards to a whole system approach to falls prevention within Derbyshire and giving us that overview of the commission service. Oh, thanks, Adam, for the for the agenda there. We've also going to have a bit of time afterwards for some questions for Caroline. If anybody has any questions, so please save those. And we are also going to be talking about the community benchmarking in Carlton as well. We've got two other features that we're actually going to spread out into the next webinar. We're going to have a two-part for this one. Sorry, I think I'm... Oh, sorry. I could hear a bit of an echo then, but it's gone. So yeah, so we will have in the next webinar from Karen from Nottingham Forest Community Trust talking about the walking football with a particular focus on Parkinson's, and that will be in the next webinar in this series. So I am going to hand over to Caroline to talk to you about the Live Stronger for Longer.
Oh, that's lovely. Thank you ever so much, Melissa. That's great, and thank you for inviting me today. It's been wonderful. Really looking forward to coming talking to you all a little bit about the falls prevention service that we have in Derbyshire. So I'm Caroline Waller. I'm the Advanced Public Health Practitioner. I've been in my current post for about the last 18 months, and with a focus really on reprocuring our falls prevention service, which is what I've been sort of tasked with doing, and we've been successful in completing that, and we're currently in a sort of mobilisation period of our new service. So first slide, please. Aha, brilliant, thank you. So for those of you that don't know, Derbyshire is a kind of a landlocked county. We have 8 districts in total, and we have a really varied landscape. It is more densely populated in the areas of the east and the south, with large areas of rurality over to the west and certainly within the north of the county, which the Peak District is a key feature of that area. So real swathes of rurality, and probably matching very similar actually to sort of some areas of Nottinghamshire. Our largest town and sort of area of urbanisation is Chesterfield, which is sort of in the sort of the north area of the county. So I did a little look at our kind of population data with regards to our older population and sort of really the target audience for our falls prevention service. And this data comes from 2020 with the highest number of people aged 65 years and over in our Amber Valley area, which is to the east of the county. And the district with the lowest number was actually Bolsover. But as we know, these are all sort of subject to sort of variance, and some areas, obviously have, greater need than in other areas. The thing with Derbyshire to kind of bear in mind, probably very similar to Nottinghamshire, is the fact that we are bordered by really, quite large other counties with access to sort of, quite major cities and services, with Sheffield and Manchester in the north, Nottingham obviously over towards the east, Macclesfield in the west, and we've got Leicester in the south. So there's lots of opportunities for our residents to, go across the border and access services, and the same from other areas coming into our area as well. Next slide, please. So I'm going to talk a little bit around how it kind of came about, really, and how it all began. So we've been very fortunate within Derbyshire that we have been able to have a falls prevention service for quite a number of years. And it all kind of started way back in sort of 2010, 2011, when a new falls prevention strategy was being developed. Age UK at the time were already a provider that were already delivering chair-based exercises and otago in Erewash, which is a district within Derbyshire. And they were doing that in partnership with our local NHS provider at the time. And they decided that a new falls prevention strategy should be delivered. And out of that came some kind of key headlines, really. One of them was that, they really felt that there were lots of barriers to older people maintaining preventative exercise. And that was identified by professionals during that consultation. The strategy was aimed to sort of improve the quality of community falls prevention activity. And it was obviously, they wanted to meet the evidence-based standard. Other issues that kind of came out of that was around a real lack of confidence in the provision that was already, available within Derbyshire. There was a lack of capacity anywhere. There were also big significant gaps across the county's coverage. So whilst obviously some areas were being already covered by a provider in Erewash, that obviously wasn't being translated into other areas across the district. And there was a real lack of coordination. So the idea was that they would look at putting falls prevention under a banner, really, and under an actual, a real kind of branding. And that name that was devised was Strictly No Falling, and maybe a lot of you have already heard of the Strictly No Falling brand, and it was seen as being a real quality mark. So actually, if anybody was to talk about Strictly No Falling, they felt that they were able to really give confidence that actually this was a real good quality service. Next slide, please. So this obviously continued, and in 2013, initial grant funding was given to commission Strictly No Falling, and to begin with, it was really done as a bit of a pilot, and it focused on two very distinct areas across Derbyshire, which was South Derbyshire and Erewash. The reasons behind this was down to data. It looked at population data, it looked at falls data, it looked at what we knew was happening within those areas. And at the time, the north of the county was still overseen by a local NHS provider. So Strictly No Falling between 2013 and 2014 really developed in scope and scale. And under that kind of new branding, it was really, it really went out there, and it sort of really laid those very key foundations. The work was more monitored, and results and progress with the service, and really the growing demand for more preventative services, led to it being commissioned rather than it being grant funded. So in 2014, it became that commissioned service, and Age UK were awarded the contract. And it continued really just to gather pace and to gather momentum as it kind of rolled its way out across the county, and obviously, was doing an incredibly good job, and it was evaluated very strongly. So in 2016, the programme was actually brought under one single contract, and that was mainly around improving that access to the whole county. And what happened in the end was that when the NHS provider in the north, they actually were subcontracted within Age UK to continue working within the north, and it actually made those links with our kind of community clinical services much stronger, and it really really grew those relationships. So it actually was an all-encompassing sort of service. Next slide, please. So just to talk a little bit around what that really looks like. So our approach to falls prevention in Derbyshire is to have a lead provider role. And that, all these bullet points here are very, very short summaries really of what that really entails. So they are around supporting the community-based exercise groups, and they do this in lots of different ways, but one of the main ways obviously is to manage the referrals, and the referrals can come from a number of sources. We've spent the last 10 years really growing that we're growing that base of referrals. So they can come from primary care, physios, OTs. We've got a really great relationship with our local housing departments and our fire and rescue service, who go out and do safe and well checks. We get referrals from adult social care. We have referrals from local community groups, self-referrals, referrals from friends and family. So it is a really wide referral rate, and obviously the service do an amazing job of managing those referrals and triaging where people need to be. The service delivers appropriate training to the instructors and also to residential home staff. Because, as I've put at the bottom, the actual community classes are delivered by qualified self-employed physical activity instructors. Should they require some element of training, then our lead provider would provide that training for the physical instructors. They also support those instructors in setting up a group or a class in an appropriate location, if they need to have that sort of extra help and support. And they're also able to kind of support with funding of equipment and room hire and that kind of thing. The lead provider role also quality assures all the instructors and the classes to ensure that they know the instructors are doing as they should be, and that there's no sort of kind of concerns around their their abilities, or that that the individuals attending the classes are are really happy with attendance and what they're getting out of it. And the other part of the role obviously is to collate the data and obviously to do the reporting. That's the real boring number crunching bit, but actually that's, you know, so super important for us to identify exactly how the service is running and whether they're meeting the needs of the population, really. Next slide, please. So a little overview with regard to some sort of headline sort of figures and data really from 2022, 2023. Now, obviously, we were still coming out of the back of COVID, which obviously really, incredibly hit this service. We were incredibly fortunate that whilst obviously the face-to-face classes had to be stopped during COVID, the vast majority of our physical activity instructors took to providing online Zoom sessions over COVID. And even some of our wonderful instructors would, go to a road where there was 3 or 4 individuals that lived on a cul-de-sac or on a road or on a close, and they actually did them in the front garden while everybody was socially distancing. So, we were really able to maintain a large number of our participants during COVID. Yeah, they really thought out of the box. I have to say the instructors were absolutely amazing. They checked in as well. They rang and they contacted their attendees. They kept in touch with them. They really sort of, went above and beyond really to maintain all of those connections. And obviously sort of, the online classes really took off and were very, very successful. So this data that I'm showing you now is really sort of the post-COVID year, sort of full year really. And as you can see, Age UK were our service provider. The number of classes is approximately 150 a week up and down the county. So that's across the whole of the county. And we have 77 instructors on our kind of books, so to speak. The registered attendees, again, it's an approximate figure because we also have a lot of people that attend that aren't registered. So that is just our kind of very, sort of baseline number of registered attendees. And obviously we are absolutely county-wide. We go up and down the whole of the county. And obviously we do deliver in care homes as well. The activity type that we obviously, are able to provide is chair-based exercises, Tai Chi, postural stability, Otago, and a combination of all of those. That year particularly, they provided I can't get my words out. So they provided 7 training courses, and they were able to quality assure 73 classes that particular year. Next slide, please. So we're on to our next chapter. So as I said earlier, the last 18 months we've been recommissioning this service with a new contract start date of the 1st of April. So we are hurtling towards it in the next 3 weeks. And one of my real tasks was around really looking at the evidence base with regards to falls prevention. So the service obviously has been running a really long time. It's been running incredibly successfully across Derbyshire. We've over the last 10 years done lots of evaluating of the service. We've had insight reports. We've had post-COVID reports, and we were able to really get a flavour that this is a really unique service and incredibly well attended and well utilised. As part of the recommissioning process, we really wanted to be able to evidence base that, what is it that's, the most robust evidence we can find to support what, our recommissioning ideas. So we spent a long time looking at that evidence base, and our knowledge and intelligence team have actually went away and kind of spent a long time supporting us in doing that, and came back with a kind of the state of the evidence report, which was really great at enabling us to go to our SMT to be able to deliver this. And we were successful actually in gaining some additional funding that's actually gone into this contract. So actually part of the evaluation that we did before going down the commissioning route. Part of that evidence building was around looking at sort of, what's happening across the landscape, what's happening with regards to the service, where are there any gaps? And we had some feedback from some of our partners around there being a real gap at the moment with those intermediate risk individuals, where they're not particularly ready for those community classes, where maybe they are a bit more able-bodied, but nor are they this very high risk individual who has or maybe already experienced a fall or has had a spell in hospital because of a fracture, and actually are needing some far more intensive work and some more intensive interventions, really. So we were able to gain some additional funding, and we sort of looked long and hard at what else could support our service. And so we've been able to add an additional element into that. So the service went out to tender, and we have been really very fortunate in the fact that we have continued to be able to ask Age UK to continue to support us in delivering this service. They have always been our provider, but we obviously go through a really robust procurement process. But we are very fortunate. They are, they've been around a long time. They know this. They know Derbyshire. They know this client base incredibly well. They work really well with them, and they're super excited about the new contract and the new service that's coming on board. So we're really fortunate. I have to say that Strictly No Falling as a brand is going to go, and for a lot of people that's a good thing. We did a really big insight report, which was it started just before COVID and ended up going into COVID, where we actually spoke to a lot of our older population and some of our professionals around the branding, and actually a lot of people don't like the word falling within a brand. They didn't really sort of see it as being, or didn't really want to identify it for themselves. So we've rechanged and we've rebranded the service, so it will now be known as Live Stronger for Longer. So watch out for it. You will be hopefully immersed in the Live Stronger for Longer branding. And as I've just said, we're going to be the new service is going to be enhanced with a couple of new elements to it. The community clinics will, community classes, will completely stay the same. Nothing will necessarily change around that. But there's two new elements to it, which is Live Stronger for Longer Home, and our new which will now be a funded element, which is the FAME element. So that's the FAME programme, which is the Falls Management Programme. Next slide, please. So for those of you that don't maybe know what FAME is, there's just a bit of information there. So obviously a FAME programme was developed actually in the East Midlands with, in conjunction with Nottingham University. And we've looked at several programmes, but this was the one that we really felt gave us that robust evidence with regards to real progression. And for our new service, what we are really keen to find out is around that journey travelled for those individuals. So when they come into our service, we want to know their starting point, and we want to know where their finishing point is, if they ever do finish. And what we find at the moment, certainly within our community classes, is that we've got individuals that have been coming for 10 years. They come because not only do they get out of it the strength and balance that is absolutely needed, but that beautiful element of social connectedness, community, friendships. It's obviously given many people an extra lease of life and been able to support them in a way that potentially they hadn't thought was going to be the case originally. But we hear lots of stories of, they go to a community class 10 till 11, and then they're all across the road at the cafe for the rest of the afternoon, where they have coffee, they have lunch. Those lovely connections are really embedded, which is fantastic. So so our opportunities really to add FAME into this contract was around kind of the identified gap that came from our kind of full system. around that sort of real element of there's a real gap here for some of these individuals. We wanted to be able to offer that real evidence-based programme, and FAME absolutely delivers that. It's a very intensive 24-week programme, which will now be a fully funded programme via public health. And it also really supports sort of that falls pathway work that within our system, within Derbyshire, we're working really hard to create, in the fact that it obviously provides that kind of step up, step down approach. So those individuals, like I said before, who are, who potentially had a fall, have been in hospital, have maybe gone through the clinical teams, and they're not ready for the community clinic, they've potentially got the FAME as a step down approach, but also it will work the other way as well. So those that have potentially lost some confidence, have had a couple of near misses or a couple of trips and falls within the community classes, who are again losing a little bit of confidence, there's that step up approach. So we're really hoping that this will moving forward will really give us a really great service to offer within Derbyshire. Thank you.
Oh, Caroline, brilliant. Thank you so much for explaining all of that. There was lots of things resonating with me as you were talking there, some of the parallels that we see in Nottinghamshire. And I really liked the piece at the end where you were talking about it being more than strength and balance, and that sense of community. In fact, just before we all came on the call, the project team and I were all talking, and Fran, who loves a quote, found this, and we all really liked it. It was, "The power of community to create health is far greater than any physician, clinic or hospital." And so as you were speaking at the end, that really resonated with me.
Yeah, and I think that's really what's come out of all of our evaluations that we've done over the last 10 years, and it has been quite strongly evaluated, that actually that element of social connectedness and friendship, and certainly over the COVID period of time, that really was what has held a lot of people together. So I think it's something that maybe we don't necessarily think about, but obviously with it being an ageing population that's generally utilising the service, that those feelings of loneliness and being isolated are really really apparent, aren't they? And so actually, yeah, this has been something that's definitely supported that population.
That's great. Thank you, Caroline. What I'd like to do is just open up to the floor really, and ask for any questions that having heard Caroline speak, is there anything that you as the community of practice, you as the audience, would like to ask Caroline? What I'll ask is if you could pop hands up and we can come through to hands up, or you can put your questions in the chat. While you're all thinking about putting hands up and popping questions in the chat, I have a question actually. I was really impressed to hear that you have 77 instructors. Certainly locally, it's something that we hear a lot. We hear about how it's really difficult to find and train instructors and then keep instructors. So I wondered if you could share your experience in overcoming some of those barriers in finding and training instructors.
Well, obviously, it's something that Age UK actually do. So obviously they are the experts in sort of being able to kind of find those instructors. I think it's a lot of it can be word of mouth, a lot of it can be they do obviously advertise as well, so that's a way of obviously recruiting them. I wonder whether the fact that these are self-employed instructors, or the vast majority of them are self-employed instructors, whether that's something that it's a really flexible way of obviously working for some people. Some of it could be in the daytime, it might probably fit around other commitments, children, those kinds of things. I also have to say, because we've been around for so long, a lot of the instructors have been with Age UK for probably 8 or 10 years, and so I imagine it's probably down to the fact that they are really well looked after by Age UK. They do a phenomenal job. They really do, you know, support those instructors. They're given an awful lot of kind of time to talk to them around, you know, the group, setting things up. Their hands are held really nicely. So I imagine that actually, you know, they probably just enjoy working, you know, with that organisation.
Yeah, some real workforce acknowledgement and quality in there. Thank you, Caroline. I can see that Helen Smith has her hand up, so I'm going to come to her next to ask her a question. Thanks, Helen.
Thanks, Alice, and thanks, Caroline. There's loads of questions I'd like to ask, but I'm going to narrow it down to a few, if that's okay. In terms of where you run the classes and ensuring that people that maybe haven't got their own transport, or, you know, in areas, less affluent areas, how do you ensure you've got the cover and equity of access for all people that might want to attend the group?
Yeah, so we, again, within previous contracts, that was something that was noted, that, you know, ideally that, you know, areas of sort of need were identified, and that actually, yes, we know we had as good coverage as possible. And I think that's probably a challenge, and I think probably has been a challenge over the years, although I have to say, with over 150 classes up and down the county, you know, we have exceptional coverage. And I think, again, that's down to the links that Age UK already have with district and borough councils and parish councils around, you know, accessing community centres, village halls. They really do sort of spread that reach as far as and wide as possible, really. We always have the difficulty if an instructor decides that they no longer want to do it. And so potentially there are some classes that close. And then again, it's around, you know, maybe trying to train instructors quickly to obviously fill that gap before, you know, the sessions kind of closed and those individuals then are not supported. But I think, you know, on the whole, we know they do an amazing job. I mean, we have noticed that there have been some areas, and Bolsover actually is an area where our numbers for Age UK classes has actually been quite low. But we've been able to work really closely with our district council and realise that actually they were putting on some classes that were kind of tied in with their wellbeing service, and we've now just decided, you know, we're just working really closely now with those local, you know, district council to actually improve those sort of, you know, links and be able to kind of work with those participants and those other instructors, so that it's not a competition. We don't want to, you know, absolutely flood the market with everything to do with Age UK. We absolutely want to work in partnership with those independent people who are running, you know, strength and balance classes or are participating in falls prevention, and, you know, but what we would like to do is obviously just be able to know about them, so that actually, you know, we can, you know, talk to them about training. We can ask them if they wanted to come under the umbrella of Age, you know, Age UK. But I think, you know, being really mindful around sort of equality is one of the key areas that we constantly keep an eye on, really. You know, I've been very fortunate. I wasn't here in the early days when this was sort of being set up, and I imagine there were lots of challenges. I've kind of come in when actually we're doing super well. I'm very fortunate.
Just one other quick thing. I think it's striking how the infrastructure really supports the coordination of everything, which is something that we don't have here, but it's really powerful how you've got all that connection and the support of the actual instructors collectively rather than in their own right.
Yeah, no, I think that's right. And I do think that having that that coordination role and having that lead provider role has actually been is quite unique, but I think has absolutely been what's been paramount to kind of keeping this kind of ship afloat and making sure it's going in the right direction, because without that coordination, I'm not sure, you know, it would have necessarily been as successful as it has been. But that's not to say that there hasn't been challenges, because there always are, and that it's not been, you know, not been a plain sail all the way, because I imagine that absolutely there's been times where it has been really challenging for Age UK required to, you know, keep staff or, you know, keep it moving in the right direction. But I have to say, I think, you know, that Age UK, Derby and Derbyshire, you know, they are part of a bigger infrastructure. You know, the Age UK is nationwide, and so, you know, they have lots of sort of back office support should they need it. But what I would say is that we are very fortunate. They're incredibly passionate. They are a very passionate service, and so we are incredibly fortunate that we've got them within our area.
Thanks, Caroline and Helen, for your contributions. Really helpful observations and thoughts that are coming through there. We had one question in the chat around what does LSFL home stand for? And it's been, and I think we sort of answered it, live stronger for longer, and it's the digital option at home. Is that right, Caroline?
That's right. Yeah, that's right. I'm not sorry. I've not looked at the chat. I'm not very good at multitasking.
That's fine. That's my job,
yeah.
Caroline. That's what I'm here to do. That's fine.
That's so yeah. That's a new element that Age UK have added into this new service. So the Live Stronger for Longer home will be, I guess it will take over a little bit from those Zoom classes, but this will be for those who are housebound or who maybe have accessed Strictly No Falling classes before, and then, you know, due to maybe a change in circumstance or an injury or an illness, have no longer got the option of coming out to one of the community classes. And so there will be a video of some description that then they can actually access within their home, to kind of keep them, you know, physically active and to try and encourage that sort of strength and balance within the home. Yeah.
Thank you, Caroline. That feels really important, doesn't it, to be able to offer people options to move more and to enjoy strength and balance exercise in ways that feel good for them, so that we're getting that participation and involvement. I've got one more question for you, and then we're going to move on to hear about a benchmapping project. But we'll just finish with one final question, which is popped up in the chat here, and it's around actually around the money, because that's what it all comes down to, doesn't it? That's how these things start. That's how these things keep rolling, and keep being evaluated. So the question is, please, can you clarify the annual contract value and duration? Is it 4 years? Is it 2 years? What does that look like when in Derby?
Yeah, so it's Derbyshire, actually, just to clarify.
Sorry,
that.
Thank you.
It's excluding Derby City, so this is purely a county service, but it does not operate in Derby City. So the current contract is actually it's 5 years in total, with a 2 + 1 + 1 + 1. The first 2 years will be very heavily evaluated. We obviously want to make sure that these additional elements that we've actually put into this new service, into the new contract, will, you know, do as we would like. You know, we're hoping that they will do. So we're going to evaluate it quite heavily in the first 2 years. And then obviously we have those options to extend. I'm really sorry, but I don't have the figures off the top of my head for me to be able to share with you today. But, you know, we obviously have added in this extra element of funding. So the contract is significantly higher than it was or has been previously.
Thanks, Caroline. I know I said that was one last question. I'm lied. There's one more popped in, and it's a real practical one from colleagues at NUH, who I guess there's some cross-border covering happening there, and would like to know how we can refer individuals to the service.
Yeah, well, I have to say this is probably the simplest thing ever. So it is so easy. You just literally, either you can ring, you can email, you can you can do it in any which way known to man. And really all that they need is the name and a contact number of the individual that you would like to refer them into. We don't need, or the service does not need, their inside leg measurement at that moment. All they need is some really basic information. It is the easiest referral system known to man. There's not a complicated form. It is just simply, the individual's name and a contact number, and then Age UK will do the rest. They're really incredibly practiced at kind of triaging and the whole part of the next phase will be that there will be a kind of a two-step triaging process. So they'll receive a referral, they turn that around, they will speak to the individual, they will potentially contact the referrer to get a view on, you know, how they feel and what particular element that person is looking for, and then they will be triaged either into a community class or into FAME or whatever they feel is the appropriate way. But it's a super easy you know, process. So I can pop that into the chat if that's okay.
That would be really helpful. We've got a few other questions coming through, so I am going to direct you to the chat now, and I'm sure we can continue the conversation in the chat. And please continue the conversation after the webinar in our Futures platform. That's the point of the Futures platform. We'll share details of that shortly. Lovely. I'm going to hand back to Melissa now, who's going to introduce a really fabulous project.
Thank you so much, Caroline. I think from the amount of questions there, it's clear that that's something that everybody was very interested in. So that's brilliant. Thank you. So in terms of making movement a priority in communities, what we wanted to also share was a piece of work that's happening in Carlton at the minute. And there's a series of falls prevention classes happening in Carlton. They are embedded and have been for a while. We actually got some funding through the Jigsaw Foundation to actually enable one of the postural stability instructor to become a connector outside of those classes as well, which has been really powerful. And part of that work has really enabled us to think about how those participants are getting to those classes and how they're moving around in their communities. And I guess it's made us think about that bigger picture, in that, you know, people might turn up for their falls prevention classes, but what is their mobility in general? What we started to hear in Carlton, which is has quite an aging population in quite an undulating landscape, was that people were starting to feel quite trapped into their homes, and getting out and about was a bit tricky. So this was really a bottom-up approach that we were able to then, through what the community was saying, think about how they were making their way around the community in terms of their mobility. And actually benches are a really big part of that. The people need those places to stop and rest and plan and map out those routes and those walks that they could take to enable that mobility. So we've got a video to play, which gives that overview of the Carlton bench mapping, and then we're also going to have Adam afterwards giving us a bit of the technical how that we actually kind of pulled this all together.
It started off that we've got like a little group of local partners that meet in Carlton every kind of like 4 to 6 weeks. And one of the partners, Susie Leighton from Age Concern, really wanted to relaunch their age-friendly Carlton scheme that they'd had before the pandemic. So thinking about how to make Carlton a safe place for local residents to go to. So in terms of like trying to work out what we were going to do with that, we thought it's really good if we actually go out and talk to local residents and find out what helps them to get out and what the barriers are to them getting out. So what we did was we then got 3 kind of like focus groups of local residents together to chat to them about that. So one of the groups came from the Age of Concern attendees. Another group was a group of residents that we already knew in a local housing scheme. And another one was a group of people that come to an exercise class. So we went and chatted to them. Now, what was great was because we already knew them, we had a really nice conversation. So they felt really comfortable about telling us, you know, like what worked and what was a bit more difficult for them. And out of those conversations, we got a number of different things, but 2 of the things were, we want to know where we can sit down. If we're going out, we want to know if we can sit down and have a bit of a breather. And we also want to know where the toilets are. Then we thought, okay, so that's, you know, like, is what is preventing them from getting out and about a bit more. What would it be like if we could actually find out where those benches and toilets are, and that might help them to get out a bit more? So that's where the idea of doing this bench mapping project came from. And then what we thought was quite good if we could actually get some of those residents to find out themselves. That's a way of them getting more active by going and looking. But also they've kind of got a bit more ownership of the project. So again, we went to groups of people that we already knew. So the age concern guys were going out on a sponsored walk, so they had a bit of a treasure hunt looking for the benches and the toilets while they were doing that. We had a group of people from a local housing scheme going out and doing the same thing, a local walking group, a running group. But then the momentum was going. I couldn't go anywhere in Carlton without people popping up and saying, oh, I spotted this bench, or, you know, these are where the toilets are. So then we found that in other meetings that we were going to, people were saying, oh, I can help with that because I walk my dog around this park, or I pick up litter around this recreation ground. So they wanted to get involved. So the word was spreading in Carlton, and more residents are wanting to get involved. So what happened then was people would go out, and if they found a bench, they'd take a photo of it, and then they also logged it, the exact location, using the What 3 Words app. And then they filled in an online form that Active Notts had developed and sent that information through, which I think went to a spreadsheet, very clever spreadsheet, which then logged all of those positions on an online Google map. Now, obviously, some people were a little bit anxious about using that technology. So what they would do is take a photo of the bench and just email me, or just tell me about, you know, where they've seen it, so the road it was near or a particular shop. So we got all of this information in, and then we developed an illustration of the map of Carlton with all of those benches and maps and defibrillators and car parks on it. So great big map, and then we took it out to community events to show residents and say, this is what we found. Are there any more benches, maps, defibrillators, car parks that we've missed? And that was great. So we went to Health and Wellbeing event, we went to the launch of the Carlton Community Hub, and people found it really interesting. They wanted to kind of look to see where they were. We had a councillor come and say, there's a bit of a gap here. And then we could talk about what we were doing. So that was a really lovely way of sense checking what we'd done, finding more information, and then kind of getting the message out there that this is what we were doing. So we used all that information, and then we produced a little leaflet which opens out, and then you can see the map of Carlton where all the amenities are. We've got some fun facts on the back, where all the green spaces are, where the skate park is, where the parks are, where the cemetery is, where the bus routes are. Again, really useful information. Scan the QR code and you can get through to the online version. So some people obviously live by their phones. It's really good to be able to do that rather than having paper. A lot of people really like the paper. They like being able to open it out and see where they go. So we sent it out online to lots of the local partners, so to social prescribing link workers, to adult social care, to people that are running the various community venues, so the Carlton Community Hub, Age Concern, the local church groups. And then we sent out paper copies as well, so distributed them at the library, at the doctor's surgeries. And then actually went into some of those places, and this was quite interesting because although they got some of them up on a display board, some people hadn't actually seen it. But when I went in and kind of like opened it out and started talking to them, they could see, they could say, oh, look, I could actually walk out here, couldn't I? And then I could sit on that bench. And then I could come back here and I could go to the loo if I needed to. So it was quite good then being able to see on that piece of paper what they could do. So these are out there. We're getting quite good feedback on them, and people are really seeing how they can be used, particularly actually those social prescribing link workers who are trying to encourage people to get out, just to take that first step out the door. And actually, as a result of some of the conversations that we've had with residents, they're saying, oh, maybe we could like have a little walk. And so we're now thinking of having a leaflet like this called 5 Easy Walks around Carlton, so a walk route. And the idea would be that it would go from a community venue, so it's somewhere they can meet that's warm and safe and go to the toilet if they needed to. Then they could go for a little walk, and then they've got somewhere to come back to afterwards. So it wouldn't necessarily be a walking group, but it would just be walking routes. And we've also been asked to use this information in funding bids for developing parks. And we've also been asked by the council to find out where the gaps are in the benches, so that if they do get some money donations, maybe from people, they know where they could actually put a new bench.
And we're really fortunate that we had the Carlton Community Connector that could actually then take that idea and turn it into a reality, obviously with the support of partners, but having somebody that was able to essentially do all of that legwork, going around, looking at benches, setting up focus groups to check and challenge whether we've got the right benches in the right places, to make sure that we had the resident voice. That all needed to be pulled together and coordinated by an individual, and we were really, fortunate that we had the community connector in Carlton that was able to do that. I think without that role, it would have taken us a lot longer to get to this point. If we were reliant on partner organisations doing their bit, I think it would have taken us a lot longer to get to where we are. So I think you do need to have somebody that has an awareness around technology and being able to utilise things like Google Maps or What 3 Words, and then being able to produce a map by using that as a tool. So it's probably fair to say that it might be a bit clunky for somebody that doesn't have experience in technology, and quite time consuming. And you would also need to make sure that you've got a person or people that are prepared to do that kind of work on the ground and go around taking photos of benches. So we've developed a process that took quite a bit of time, but is something that could be replicated in other areas quite easily now, providing that you have got that infrastructure around, whether it be a community connector or that type of role, or a lead organisation that are willing and prepared to do that. But I think it's also important to mention that the bench map is a great tangible product, but that isn't necessarily what might be appropriate for all communities. For Carlton, we were working with that older age cohort, and it seemed to fit quite nicely with what we were trying to achieve. We've had really good feedback from the hard copy of the leaflet. People like those printouts, like to be able to look at something. It's been very well received, particularly within that older population. But actually, if that's not a group that you're looking to target, it might be that there's something else out there that's more appropriate and more suitable for that community. So I think I would say, rather than perhaps getting caught up on the end product, it's probably more about the process and kind of what it is that you're trying to achieve at the end of that process, and that's the key thing really, and where that engagement is the most important part. The bench mapping is that product, nice product at the end of it, but actually I wouldn't focus in on that. I would focus in on the development and the process to get to that.
What I think has been really nice about this project is that we didn't go into it thinking we are going to produce a product. The idea actually came from local residents. There was a need that was identified, there was a gap there. And so we followed up on that. I think the other thing that really worked nicely was that residents were involved in helping to produce this. Individual residents, but also the groups, the local partners. And everyone got quite excited about it. So we have ended up with a product which is lovely, which is now helping people. But we've really got this strong relationship now between the partners at getting something together, working together on something, and producing something that's going to help the local residents. And the local residents are quite excited about being part of it. And I think what we've seen since doing that is that they're now supporting each other on other things, other projects, other events that are happening in the area.
Fabulous. We'll just get back to our slides.
In this course,
and
you'll learn everything you need to create beautiful, fully
wrap
functional
up.
websites from start to finish. We're going to cover the full process of web design, from planning to strategizing to structuring the right content and creating great user experience, then designing beautiful images and interface to make sure the website is delightful. And we're going to end up with developing the websites and then
Yeah, is it
publishing
just
them.
me that can
You're
hear
going to
an
get
American?
a crash course in
know where that's
Figma
coming
to
from.
design the website and then Webflow to develop it. And there's absolutely no
got that.
knowledge required for this course, as I'm recording this with
Got that.
beginners in mind. We'll be
Alright,
working
hold
on a
on, let me
project
stop sharing.
together.
Bear with us, guys. We won't take up much more of your time. We're just going to wrap up quickly, and Adam will get the slides back in a minute. If anyone is interested in how the sort of technology behind that bench mapping came about, then please do get in touch with one of us or with Adam, and we will we'll clue you in on all that. Unfortunately, we're a little bit short on time to discuss it now. We're just going to wrap up by reviewing and coming back to the beginning of our community of practice project, and sharing our vision, our purpose and aims, just to refresh all our minds and all your minds as members of this community of practice. I won't read out all our visions and aims to you, because I'm sure you're all perfectly capable of reading, but we wanted to show you how we want to connect community care and clinical together through our vision and our aims, how we want to create this ripple effect within our community, within the health and social care, charity sector, and sectors that I can't remember off the top of my head now. Can we have the next slide, please, Adam? Doing my Chris Whitty impression. There we go. So we want to observe change at all levels, but particular what we are focused on within our community of practice is our community, and we want this to ripple up to the system and down to the individual, and ultimately our goal is to create stronger, happier, healthier people across Nottinghamshire, and then hopefully beyond. Next slide, please. If you want to see some of our previous webinars on making movement a priority in our hospitals or in our care homes, they're really, really fabulous. They're all available on YouTube. They're all about an hour long. We'd love you to engage with that. They are a really good watch. Not that I'm biased at all. Next slide, please, Adam. And I'll summarise just by saying our NHS Futures platform is where you can connect online in between the webinars with other healthcare professionals, other social care professionals, and beyond. And so please do log on to our NHS Futures platform. You don't need to have an NHS email to join. You don't need to be part of the NHS. It's just the platform that we found would be easiest to moderate and was best for a governance point of view. So we've used the NHS branded platform, but anyone can join, even members of the public. So to summarise with our quote that was mentioned earlier, the power of the community, which is you guys, it's more than just the project team, to create health is far greater than any physician, clinic or hospital. We, as clinicians, often deal with ill health, but the power of a community to create health is much, much greater. And so I just want to leave you with that. If you have any questions, please pop them in the chat now. Please email us or Adam, who sent you the link round, and we'd be more than happy to catch up with you guys. But thank you so much for attending today. We are really, really grateful. We've loved seeing you all here.
Thank you.
Thanks, everyone.
Thank you.
Thank you.